Hello all, my name is Courtney Crummett and this is my presentation / poster for the spring semester 2013 at Blue Ridge Community College in my microbiology class. And my presentation is on Acne Vulgaris. What is Acne Vulgaris? Primarily it is acne. It is one of the most common forms of acne. It occurs during your adolescence. It is not a chronic disease. Some signs and symptoms of acne vulgaris are going to be your blackheads, your whiteheads, your pimples, pustules, and then in your severe cases you will see cysts and nodules that will form on the surface of the skin. It's going to be common among teens who are going through the awkward stages of puberty, and it's mainly going to affect the face, the chest, and the back. Now, what happens when your skin becomes infected with acne? Your skin is gonna there's a gland in your skin called your sebaceous gland, which you can see here in this picture. And during puberty, you're going to release higher levels of androgen, and that is going to cause your sebaceous gland to secrete sebum, which is an oily and waxy combination that builds up in your pore, and that's going to be your main cause of acne. Now what happens is that the bacteria that gets trapped inside your pores becomes infected with, and the bacteria is actually a gram-positive rod that lives in an anaerobic environment without oxygen. And the site of the pore is going to become, when it reaches the skin surface, it's going to become inflamed and have some change and discoloration in your skin. Now, it is treatable. Your mostly sought after treatment is a benzol peroxide gel. It's an over-the-counter cream. But some of the more important things to also keep in mind when dealing with cases of acne is just to keep your skin clean. Avoid any products that are going to clog your pores. Try to look for the label on products that's going to read non-comedogenic, and you should be pretty safe in buying those products. And then you're going to have some severe cases which are going to require some stronger medications, and some dermatologists might even recommend laser resurfacing or dermabrasion, which is going to help with some of the acne scars that are going to be more related to your severe cases of acne. Now, acne is going to primarily occur during the ages of 16 and 18. And then nearly 100% of all teens will be affected in some way, shape, or form of acne during these stages, during puberty. And some interesting trivia facts behind acne vulgaris that I found interesting are, I didn't realize that by taking birth control pills it can actually help to regulate acne breakouts. And the myth behind does chocolate cause acne? There's absolutely no medical proof that by eating chocolate is going to cause acne breakouts. And another fact that I found interesting is that excessive milk intake, primarily skim milk, contributes to acne breakouts. I thought that was very interesting. I did not know that. And acne is genetic. You know, if mom or dad had acne, your chances certainly increase that you were going to have acne as well. And there is a drug on the market called Accutane, which is almost a last resort drug in your severe cases. And what Accutane is a form of vitamin A, and it helps the skin renew quicker, and helps mainly with that nodular acne that forms on the skin as seen in this picture, which are going to be your large red bumps found on your back and on your face. So that is my presentation on acne vulgaris. Pretty common disorder, again, amongst teens experiencing puberty and going through all those changes and hormonal levels during that time of your life. But again, the most thing to keep in mind with this disease is that it is treatable. And I think the biggest side effect, if I may give my opinion, is mainly going to be kids just dealing with the psychological aspects of having acne and the appearance and the pressure amongst teens and what they might experience with that, and just dealing with the visual effects of acne and what it can do. But that's it. That wraps it up. That is my presentation on acne vulgaris. Thank you for listening.